Good afternoon, everyone. I'm your host and moderator, Preeta Harikrishnan, Deputy Manager of Admissions at Amrita Health Sciences, Kochi campus. Thank you for joining us today for our webinar on the Diploma in Dental Mechanics. We are excited to share valuable insights with you on this topic. And to ensure we address all your queries effectively, feel free to utilize the chat box to drop your questions or concerns. We'll address them towards the end of the session. Without further ado, allow me to introduce our esteemed guest, Dr. Anna Serene Babu. Dr. Anna currently serves as a reader in the Department of Prosthodontics and Crown and Bridge at Amrita School of Dentistry. She holds both a BDS and MDS from Amrita School of Dentistry, Kochi, and has an impressive 7 years of teaching experience coupled with over 10 years of clinical practice. Currently pursuing her PhD in bone regeneration, Dr. Anna has also authored 10 publications. Doctor, we warmly welcome you to enlighten our audience on the scope and opportunities of the Diploma in Dental Mechanics in India and abroad. Welcome, ma'am.
Thank you, ma'am. Thank you for the introduction. So shall I now share the presentation?
Yes, ma'am.
I hope all of you can see the presentation.
Yes.
Okay, so let me start by introducing, already ma'am has given an introduction. So I'm myself, Dr. Anna Serene Babu. I'm a reader in Department of Prosthodontics, and I'm proud to say that I'm an alumni of this college, both BDS and MDS, and now currently working. Now it's been 9 years of my teaching career, and so here I'm here to enlighten you on the scope of Diploma in Dental Mechanic course, which is a course that is closely related to my department, which is prosthodontics at Amrita School of Dentistry. So I am dealing with mechanical students, dental mechanic course here. So I think I can do justice to this webinar. Okay, so I hope there are many people who are wanting to know more about this course, who are eagerly waiting to join for this course. I hope this presentation finds you well. So basically, just with an introduction, let me start. What is dentistry? You might have seen dentists, you might have met dentists in your life. So dentistry is just simple terms. It's a branch of medicine which is basically focused on 3 things, basically the teeth, gum, and mouth. But now actually dentistry is growing more than that, which you will understand by the end of this presentation. And basically what dentists do is they diagnose, they treat, and also helps in prevention of further oral or dental conditions. So these are the things which usually a dentist do. So coming to the clinical practice of a dentist, actually the dentistry or the clinical practice of dentistry has 2 components. One is the treatment which is provided in the clinic immediately, what the dentist can do. But almost 60 to 70% of the clinical works are also assisted by some technical works. That is when you replace a teeth, you need to deliver a prosthesis or an artificial teeth to the patient. So in such cases, you always require a technical or laboratory help. It's almost 50 or 70%. It's not the dentist job, as you know, it is not just writing prescriptions. That is just a part, 10% of it. Mostly they treat the disease on the spot, and also they have this clinical, technical works that is assisted by that. So a person who helps them to assess this technical or laboratory work is a dental technician. So just a brush through the specialties. So we have almost 9 specialties, 32 teeth, but hundreds of problems for these 32 teeth. So we have 9 specialties. Some specialties deal with these DKs, KDs, etc. Some departments, they deal with the appearance or any alignment issues of the teeth. I'm making it simple so that you will all understand what I'm speaking about, not to use too many technical terms. And my department is prosthodontics, where you deal with artificial teeth. That is, we replace missing teeth or even missing facial structures, we can say, because we do that in Amrita. So teeth or surrounding structures, including the facial structures, are being replaced by a prosthodontist. So all these, our prosthodontist work is almost 70 to 80% with the help of a dental technician. That's why they have chosen me to present this. So the importance, coming to the importance of dental lab technicians in modern dentistry. So who is a dental mechanic? So they are usually termed as dental laboratory technicians. So what they do is they usually manufacture a dental prosthesis. That is, you must have seen or heard about crowns, caps. We usually layman call it cap. So, or dentures, which are used by the old people. So all these are fabricated in a lab, assisting the clinic. So, and this is done by the dental mechanics people or the dental technicians. And the other specialities are this orthodontics, where you put these braces to align the teeth. All these are being done by the dental technicians. So people who do that is called dental technicians, and they are in high demand and form an essential part of the dental team. So basically what they do is, it's an art of recreating what God has created. When you lose something that God has created, you try to recreate it. So these are the people who are blessed with that ability. And diploma is in dental mechanics, the course highlights, which is the main part of this presentation. So it's basically a 2-year course after the +2 or the 12th examination. And it's a very demanding and remunerative course. I mean, after that, you can fetch a good amount of money from this course. And the basic job is basically assisting a dentist in making dental prostheses, which I already explained, and also to assist in better clinical care facilities also, which I'll be talking about more. And the curriculum includes diagnosis. Even they are taught to diagnose. You are all taught to diagnose dental problems, and also to design the dental prosthesis, how to design the prosthesis, and also to manage the dental accessories of in a clinic. And after the course, the dental mechanic has so many opportunities. I'll be dealing all in detail. This is just a brush through. Work in private labs, colleges, assist dentists, higher education, etc. So basically the level of study is a diploma, a graduate, and duration will be 2 years, again +2 with physics, chemistry, and biology preferably. And the admission process is purely merit-based. The admission process all will be explained by the admission team at the end of this presentation. And tuition fee is 10,000 per annum, which is given in the website. And the job options, again, you can work either as a dental mechanic, a dental hygienist, or dental technician. All these three are possible with this course. And the expected average salary is 3 to 4 lakhs per annum. And the areas of employment is basically you can work in dental hospitals, colleges, dental labs. So these are some of the colleges in India which caters this diploma in dental mechanic course. And from that, you can see that Amrita is an institution which charges the minimum fee for this particular course. And coming to the two areas where you can work, one is as a dental mechanics or a technician, who can handle all these laboratory works of a surgeon. You can construct, design, and repair the dental appliances like this artificial teeth, which I already told, and also as a lab assistant. So in case you go to some outside countries, you can even work as a lab assistant, and you can help in conducting experiments, analyzing results, because you know everything about, almost everything about dental practice and dentistry. So you can do all these works with this degree. And mainly the education, areas of education, as I told you, one is mainly the prosthetic lab work, which comes under prosthodontics department. Then the orthodontic work. Okay, orthodontic work is there, and dental technology like CAD-CAM. CAD-CAM is one of the most recent digital advances in dentistry, and this has been the ceramic works, all that has been taught in this Amrita, because we have all the facilities and the infrastructure for all these things. So this is being taught, and you will be all experts when you go out from here in managing these instruments, and then operating complex dental equipments. Coming to our department, prosthodontics and implantology, as you can see in this picture, somebody has raised their hands. Do they want to?
We will ask them the doubts towards the end of the session.
And yeah, okay. Fine. These are some of the prostheses that we deal with. That is, starting from the first, you can see dentures, like old people wear, or even young people wear dentures nowadays, partial dentures, half dentures or full dentures. Then you have this crown type of thing, caps, or this implant options where you screw something into the bone, a root-like thing into the bone, and then you place a cap over it. So these are all these works are being done by a dental technician in a lab. So we make impression, the dentists make the impression, the measurements, everything, and we transfer it to the lab, and the dental technician mainly performs that. Okay, and towards the end, you can see some facial prostheses like the nose, eyes, and ears, and you will be I don't know how much you can get it from this. This is what being done in Amrita, because not many institutions do such complex rehabilitation. So Amrita is one of the institutions. I'm proud to say that one of the institutions, and under Dr. Manju V, who's our HOD, she's a specialist in maxillofacial prosthetics, and we have a good dental technician team, including Mr. Vinod P. Nair, who is doing this rehabilitation work. This is not outsourced to any other private labs. This is being done in our department only. So you get to work with these type of prostheses also, this facial prosthesis. So that makes it clear that it extends from simple to complex procedures. Then different types of orthodontic appliances. These are our appliances which you will be trained in. Even the pediatric appliances. So some children who might need this arch expansion and all will need these type of complex appliances, which will be made by a dental technician. Now, just coming to the scope of dental mechanics. So most of you will be eager to know about the scope after you finish this course, because we take up a career thinking of the scope in it, right? So just starting with, you can enter into a large dental laboratory. There are so many laboratories in and outside India. So you can get into a large dental laboratory and work as a part of the dental laboratory. You can work as, if you get more experience, you can work as supervisors and managers of the dental labs. Then you can get into corporate hospitals. So you know how many hospitals and private clinics are being coming up every day. So you get if it has a dental wing, it will definitely need the help of a dental technician. Then again, government hospitals. Then you can take up teaching role in dental colleges. There are almost 20 dental colleges in Kerala itself. So you can take up any of this teaching role in that. You can otherwise set up an independent dental laboratory. Either you can individually start it, or you can assist, appoint people and set up an independent dental laboratory. So these are again the explanations for that. Corporate hospitals and private clinics, they are, wherever dental patients are there, they'll be in demand for a skilled dental mechanics. And within India and abroad, talking about that, many of our alumni are placed abroad. So definitely you have a chance to get into large multinational dental laboratories. Sorry. And with sufficient work experience, you can apply for jobs in US, UK, Canada, Australia, Europe, Middle East, all these countries. And even many of the labs offer sponsorship visas also to directly go and work there. Only thing, you will have to fulfill the necessary criteria that are there for each country, like your language test scores, the council registration, all those formalities that are, even the nursing job demands all that. So all the regular procedures has to be done. But again, it is a high demand course in abroad. Then again, as supervisors, managers, set up independent labs, can be say, if you have enough amount of investment, you will need good amount of investment, but still you can think of setting up a dental lab. Work in dental colleges again, and government sector. Even the government colleges take up dental technicians after the Kerala PSC examination. So in health services, in academic services, etc. And even those who are really interested to learn more about dental mechanics, you have an option for higher education also. That is like Chief Dental Technician course, which is actually a 7-year course. And once you finish this course, that is our Diploma in Dental Mechanic course, you just need 3 more years extra to finish that course. And even there are people, some of our alumni even have pursued BDS, that is Bachelor of Dental Surgery. Those are really interested in, and those who think you can do more on this, they have gone for that course also. And even the Masters in Dental Technology course in India and foreign universities can be achieved through this after this course. Then coming to the main highlight, why Amrita? So I can confidently say that, and I'm proud to say that Amrita is the first institution in the private sector in Kerala to commence this course with approval of DCI. You should take care of that, because there are many courses happening in many places, and they might teach you dental mechanics, they might teach you assisting, chair assisting, all that, but this is a DCI approved course, which was first started in Amrita in Kerala. And it's a 2-year diploma course. It started in 2010. So you can just count on, we have almost 14 years of experience in this dental mechanics course. And coming to the eligibility criteria, so it's again a +2 pass with 55% aggregate marks in physics, chemistry, biology, and English. And the age limit is almost 17 to 23 years, in between 17 to 23 years. And selection is purely based on the marks obtained in +2 and performance in the personal interview. The admission process, I think they'll be explaining it more. For just the sake of completion, I'm just saying this. You will have to register yourself in the official website of the institutes and fill the online application form and pay the application fee. They'll be once your application is received, the candidates will be shortlisted based on again the scores in the +2 examination, and they will be called for a personal interview and counseling session, and then the committee will do the final, specialists will do the final selection. So syllabus basically, what covers in a dental mechanic is we have basic chemistry, physics, mechanics, all that. Dental mechanics, everything, oral anatomy, all that, dental materials and metallurgy. So you learn about all these in the dental mechanic course. Along with that, we have some additional things like the medical record management. Even if you go to an administration level, you will be able to, this syllabus will be able to help you to deal with such things. Then exclusive training in all the complex dental prosthetic works. So as I explained, all these dental prosthetic works, you will have to do it in this 2 years course of time, and you will be an expert when you pass out from here. Then this course usually comprises an year-end examination that includes both theory and practical. Both first year and second year, you will have a theory university examination. Sorry. And practical examination will include an exercise and viva voce also. So these are the theory syllabus. The first year we'll be covering applied physics, chemistry, and mechanics, because these subjects are required for the appliances. For dealing with these appliances, you need to know a bit of physics, chemistry, and mechanics. It's not too complex. It's just the basics, and more we'll be concentrating on the dental mechanics only. And applied oral anatomy. Then second year, it will be completely dental mechanics and dental materials, along with the computer subject. So these are the areas where you get a training in practical work. So this is too much to read on, but you can just know the headings. That is complete denture, partial dentures, fixed inlays, orthodontic appliances, implants, which I explained. I have already explained all these things with pictures. So these in detail. So this with this, I think you will know that you have so many sub branches for all these treatments. So many different types of prostheses are there under each headings. So you will be trained in all these. Here, when you come here, you will be able to see all these processes, and most of them you will be able to do it also, if you have the right interest for that. So coming to our department, faculty, and lab infrastructure of Amrita. So this is the Department of Prosthodontics. We have an exclusive aesthetic clinic, implant clinic, even a maxillofacial prosthetic clinic. Maxillofacial is what we deal about eyes, artificial eyes, ears, nose, fingers, etc. So we have a special clinic for that, and we have even the temporomandibular joint clinic. So these are the components of our clinic other than the normal prosthodontics. These are our faculty headed by Dr. Manju V. We have all the faculties with well experience, and we'll be taking classes for I think the doctors will be only taking classes for the dental mechanics. Even though you have a separate dental mechanic teacher for that, we'll be taking the dental subjects for you individually. And this is the most of the highlighting part of this presentation, that is the dental mechanics department. This person, Mr. Vinod P. Nair, he is the chief dental technician with more than 25 years of experience, I would say. And as I told you, all these nose, ear, eye process, all is made by this particular man, and he's very well experienced and skilled. So I'm sure that all the students who work under him will also be able to fetch his talents. And he's assisted by Miss Gigi Kumari, who is also a dental technician. She is also there for so many years. And now we have completed almost 12 to 13 batches of dental technicians. And 100 dental technicians have passed down from this institution. And this is our infrastructure. So we have, unlike other institutions or most of the institutions, if you see, they'll be having just a small part of the laboratory area. But here we have an exclusive infrastructure for the prosthodontic lab division, which is one area is completely dedicated for this lab division, where you have the chrome cobalt lab, the preclinical lab for the students, dental technician students, and a common preclinical lab. And then we have all fully equipped ceramic and all ceramic sections. You might not find it everywhere. And even we have an induction casting facility. This you will only understand if you come here and see what are the equipments over here. And you need to know a little bit about dentistry also to know these things. But from the pictures, I hope you understand how clearly they have arranged the infrastructure. Then the central suction unit. This is only, the Amrita is one of the only colleges with exclusive centralized suction unit, because these dental mechanics often, they work under dusty atmosphere. So the health of the technicians is equally important. So we have a centralized suction unit which can suck off all the dust and clear the atmosphere for the technicians to work. And these are the latest technology dental equipments we have here. And this is the CAD/CAM unit. You know that it will cost lakhs for this machine, and people are in demand of students who know, or technicians who know to work on this. So you will be given special training for this CAD/CAM unit in Amrita. And these are the CAD/CAM technicians. And this is just a gist of the placements of our alumni who have passed out. You can see that most of them, this is not the updated one, but most of these people, they are placed abroad, and almost 50 of them work in corporate and private labs. All are equipped or occupied with jobs. So nobody is, nobody has left out the job. They all are working as dental technicians. And this is one of the testimony by one of our technician students who passed out, and she's an alumni. Now she's working as a dental technician in Amrita itself.
ഞാൻ അമൃതയിൽ dental technician ആയിട്ട് വർക്ക് ചെയ്യുന്നു. ഞാൻ 2011 to 13 ബാച്ച് പാസ് ഔട്ട് ആയി. ഇത് 2-year ഡിപ്ലോമ കോഴ്സ് ആണ്. ഈ ഒരു കോഴ്സിനെ കുറിച്ച് പറയുവാണെങ്കിൽ ഇതിൽ വളരെയധികം ജോലി സാധ്യത, വിദേശ രാജ്യങ്ങളിൽ ഒരുപാട് ജോലി സാധ്യത ഒരു കോഴ്സാണത്. അതുപോലെ തന്നെ നമ്മുടെ കഴിവിനെ കൂടുതൽ എക്സ്പോസ് ചെയ്യാനായിട്ടുള്ള ഒരു മേഖല കൂടിയാണ്. ഈ ഒരു കോഴ്സിൽ ബേസിക് ആയിട്ടും ക്രൗൺസ് ആൻഡ് ബ്രിഡ്ജസ്, dentures, fabrications, orthodontic appliances, ഇതൊക്കെയാണ് ഇൻക്ലൂഡ് ചെയ്യുന്നത്. ഒരു ഡെന്റൽ മെക്കാനിക് ആയിട്ട് വർക്ക് ചെയ്യണമെങ്കിൽ ഡെന്റൽ കൗൺസ് രജിസ്ട്രേഷൻ നമുക്ക് വളരെ അത്യാവശ്യമാണ്. അതിനപ്പുറത്തേക്ക് ഈ കോഴ്സ് നമുക്ക് വളരെ അനുയോജ്യമാണ്. അതുകൂടാതെ തന്നെ ഡിജിറ്റൽ ഡെന്റിസ്ട്രിയിലും നമുക്ക് ഒരു ഡെന്റൽ മെക്കാനിക്കിന് ഇതിന് വളരെയധികം സ്കോപ്പ് ഉണ്ട്. എന്നെ സംബന്ധിച്ച് ഞാൻ അമൃതയിൽ വന്ന ഈ ഒരു കോഴ്സ് പഠിക്കുവാനും അതുപോലെ തന്നെ ഇവിടെ തന്നെ ഒരു സ്റ്റാഫായിട്ട് വർക്ക് ചെയ്യാനും സാധിച്ചതിൽ എനിക്ക് വളരെയധികം സന്തോഷമുണ്ട്. അതുപോലെ തന്നെ ലൈഫിലെ ഒരു ടേണിംഗ് പോയിന്റ് തന്നെയാണ് ഇത്. താങ്ക് യു.
So with this, I hope I have done justice to this presentation, and I hope everybody has understood what is the course and the scope of this dental mechanics diploma course. So if you have any queries, you can please feel free to ask.
Thank you so much, ma'am. The presentation was really very clear, precise, crisp for all those attendees who have been here today. We had 11 applications actually. So we tried calling all of them, and we are expecting more because registration is still going on. So anyway, this will be in the YouTube also, ma'am, so that they can, anyone who wants could see that also. So before that, let me see, there was someone who had raised his hand. Anyone who has any doubts could ask it now, or you could just drop your doubt in the message box. Mohammed Farsin, I think you are the one who raised your hand. Any doubt? Mohammed Farsin, you could unmute and speak. So let us see, ma'am, if there is any doubt, we shall answer them in between. Meanwhile, before we wind up, we have from the admissions, Priya, who will explain to us about the admission process this year. Priya.
Thank you, ma'am. Good afternoon, one and all. I'm Priya, representing Admissions Office, Amrita Institute of Medical Science, Kochi campus. So today I'll be briefing on the admission procedure for Diploma in Dental Mechanics for the academic year 2024. So coming to the duration of the course, so the duration is of 2 years, and the eligibility, candidate should have attained minimum of 17 years of age and maximum of 23 years of age on or before 31st December 2024. And coming to the educational eligibility, you should have completed your class 12 with a 55% aggregate marks in physics, chemistry, biology, and English. Now coming to the fee structure, we have two categories in the diploma in dental mechanics. That is, tuition fees in the scholarship category would be rupees 10,000 per year, and in the non-scholarship category it would be 15,000. Also, we have an other fees of rupees 32,885, and hostel and messes rupees 68,000 per year. So the mode of selection, you can submit your applications online through this web portal, that is applyug.amrita.edu. The online application fee is rupees 550. So as ma'am said earlier, selection will be done based on an interview which is conducted for the registered candidates. So now coming in detail to the registration process, as I already said, the URL is applyug.amrita.edu. So once you enter this URL, this is the main page, the registration page. So you need to sign up with your email ID. So once you sign up with your email ID, your personal information would be asked, like your name, gender, date of birth, your registered email, mobile, etc. So once you fill all this step, you can move to the next one. That is, you can choose the respective campus. That if you wish to apply for diploma in dental mechanics, you can choose Kochi campus, select diploma in dental mechanics, and click on the apply button. This is the step 3. And moving further forward is the payment option. You can choose the payment option. We have given various modes of payment like cards, UPI, net banking, etc. You can confirm your payment option and move forward. Once you've done the payment, your registration number would be sent to your registered email ID, and that is your confirmation that your application has been submitted. Moving forward is the fifth step, that is submitting your academic details. Your class 12th and 10th details are asked, so you need to fill all of them. And the final step is document upload. Candidates are requested to upload all the documents, all the mandatory as well as which all documents you have with you. And this is the final step of registration. Okay, so these are our website IDs, official website IDs, amrita.edu/admissions and amrita.edu/program/diploma in dental mechanics. All the details which I mentioned now, we have clearly displayed in the website. And our official portal for registration, as I already told, is applyug.amrita.edu. So the applications are still open. So it will be mostly open till June. So you're requested to register online, and the dates of interviews will be intimated to the candidate via your registered email ID. For any enquiry regarding any admission related queries, you can kindly contact us in the numbers we have displayed here, or you could send us a query mail in ugAdmissions@aims.amrita.edu. Also, kindly note that Amrita Vishwavidyapeetham has not appointed any third-party client for securing admissions in any programs. So that's all. Thank you, one and all. Over to you, ma'am.
Thank you, Priya. You did that well. So I think all of them would have been clear. There is one question, Madam, are there any tips to qualify the interview? I think it is a candidate who wanted to.
Okay. That's a tricky question.
Yes, tricky question in between.
Yeah, you just need to be genuine to your desire. That's it.
Yes.
So you have a base in your 12th standard. So no one will be asking about you. If you know something about dental technician course, that's enough. That's more than enough. Otherwise, you can just have a base of your 10th, 12th base subjects. That's it.
Yes, that was only clever question that we got in there. I think all the others are very clear with what you said. So anyway, ma'am, I'm so thankful that it being a Saturday, you had to go home, but you still stayed back for giving us your precious time. And this webinar has really been one which enlightened everyone who had, and even motivated them, I suppose, from the way you had presented it to them. I'm thankful to you, ma'am. I'm also thankful to all the attendees who have attended this webinar today. It has been a pleasure having all of you with us today. Thank you for the participation. So, and I hope you have gained valuable knowledge and feel inspired by this webinar. So I think we could conclude this webinar on dental mechanics today. Thank you, ma'am. Once again, goodbye. Take care, all of you.